talk about anemia, you are obviously aware that there are a lot of anemias. What are different types of anemias? Apart from iron deficiency anemia, what else is there? What other anemia do you know of? Have you heard of any other anemia? Huh? Apart from iron deficiency anemia, okay. Any other anemia you know of? In physiology, have you been taught? Huh? Is it something? What is it? Bola? Tell me. What is it? What is other anemia? Just take a guess. No problem. Arkono anemia is bolo. If you heard the name somewhere, some familiar thing. Iron deficiency anemia is not the only anemia, but it's the most important. So, do you know any other anemia? Huh? Pernicious anemia, very good. So, we will not, pernicious anemia also called megaloblastic anemia. Okay. So, when we talk about iron deficiency anemia, what is anemia? Anemia is first a condition which is a lower than normal number of RBC or less hemoglobin also. Okay. So, iron is very essential for the hemoglobin synthesis and for transport of oxygen, and iron deficiency is anemia is a condition which there is a body lacks enough red blood cells to transport oxygen rich blood to body tissues. So, this is the basic fundamental thing regarding iron deficiency anemia. She said pernicious anemia, that is also called megaloblastic anemia, but that is due to deficiency of vitamin B12, and we will not go into that at the moment. Our topic is iron deficiency anemia. So, this you are familiar with this cycle in your physiology, how it is synthesized and how this happens, the RBC cycle, so to say. And it develops over time if the body does not have enough iron to manufacture RBC cells. Without iron, the body uses up all the other iron it has stored in the liver, bone marrow and other organs. So, body cannot manufacture iron so fast as it gets depleted. So, this is the problem. As soon as the iron is decreased for some whatever reason, the body cannot replace it straight away. So, it takes up all the body which is stored in the liver, bone marrow and other organs. So, this picture you are familiar with in your physiology. Have you seen the slide? Yes or no? Anemia slide. What does the RBC look like? The normal picture, what does it look like? Normal picture you will find, normal slide you will find this. Anemia you will find this. Okay, pale RBCs. This is the classical picture of thing, and this iron deficiency anemia is also called normocytic normochromic. Microcytic hypochromic. So, now what is iron deficiency anemia due to? Usually due to blood loss, poor diet and inability to absorb enough iron. These are three main causes. So, blood loss can occur for various reasons. Inability to absorb food, that also can occur if there are some problems, inherent problems in the digestive tract or some other thing. And third one is poor diet. So, what are the causes of blood loss? Blood losses causes iron depletion. One of the main causes is in women we have heavy menstrual bleeding or fibroids, and then childbirth, and again internal bleeding for various reasons. The person may not be knowing that the person is bleeding. Now, it does not mean that always a lady has to bleed more. A man can also bleed. He can be bleeding from the gastrointestinal tract. He can be having blood loss in his stool. So, that is internal bleeding. Poor diet, low iron intake, and during some stages of pregnancy, like pregnancy and childhood, the person needs more iron. Okay. So, that same diet is not enough for the person. What the person was taking before pregnancy, that same diet is not enough for the person during the pregnancy or at childbirth. Again, inability to absorb enough iron. Suppose you have had an operation, major operation in the intestine. It may not be possible to absorb the iron, and there are also medicines which reduce acid in the stomach, that also can reduce with that interfere with iron absorption. So, antacids or H2 receptor blockers, they generally interfere with iron absorption. So, these are two things why the iron is not absorbed properly. Okay. Then this is the classical clinical picture of iron deficiency anemia. What do you see? Please look this side. You have brittle nails. It's also called koilonychia, that is spoon shaped nails. Second is cracks in the side of the mouth. Okay, you have cracks in the side of the mouth. This is a classical symptoms, classical pictures of iron deficiency anemia. Then you also have extreme fatigue. So when we say extreme fatigue, people say I am very tired. Okay, you've traveled to some place, you're tired. But some people always say extreme fatigue always. So those are the things that we think may be due to, we think of anemia also as a cause. Then chest pain. Now chest pain, we think that chest pain is something always a cardiac problem or something else. It may not be, it may be a sign of anemia as well. Then pale skin. Quite often, pale skin, the skin is very fair, very pale. So we might think that this person is undergoing some beauty treatment or something, but maybe a cause of actually anemia. It's sign of anemia. Then dizziness or lightheadedness. Matha ghurche. Okay. So that again is a possible sign of anemia. So you have complaints like these are two signs. Symptoms of extreme fatigue, chest pain is one, pale skin, dizziness or lightheadedness. Then fast heart rate, tachycardia, what we call tachycardia, and headache. These are all possible signs of iron deficiency anemia. So many of these symptoms are very common. We may miss it. We may think it is this, nothing to do with anemia, but it's always good to do a blood count to find out the anemia. Okay. Then you have some more clinical pictures. Enlarged spleen, then cold hands and feet, then frequent infections and irritability, shortness of breath, and swelling or soreness in the tongue. So each one of them, enlarged spleen of course comes when the patient, anemia is for a fairly long time. Spleen won't come just by 1 or 2 days. I mean, it won't get enlarged in 1 or 2 days. Second one is cold hands and feet. The third one is frequent infections. The fourth one is irritability. The person gets very irritable. At small things, the person gets very irritable. Then shortness of breath. He is having dyspnea on exertion. And swelling or soreness of the tongue. Okay. So, the tongue. Then this is something very peculiar. Unusual craving for non-nutritive things like ice, dirt, paint or starch. You might have seen or you might have heard of some people eating mud. That is a sign of anemia. That is also called Pica or Pica. Okay. And they also have iron deficiency. Some of them develop restless leg syndrome. It's a disorder that causes strong urge to move the legs. Okay. But this Pica is pretty specific. People take the dirt, people take starch, people take paint. All this is called Pica. This is again a sign of iron deficiency anemia. So you won't find this in this pernicious anemia. You find this over here. Okay. That is an unusual craving for non-nutritive substance such as ice, dirt, paint or starch. Then some signs are related to the conditions caused. For example, there may be a sign of interstitial bleeding is bright red blood in the stools. So very often when we go to the toilet, we don't look at what is the color of stool. But when there is diarrhea, of course we know it's diarrhea. But if it's a reddish tinge, it could be a sign of anemia or even tarry looking stools. Okay, like blackish stools. And again, very heavy menstrual bleeding and long periods or other vaginal bleeding may suggest that women are at risk for iron deficiency anemia. So these are two things which are important. Internal bleeding resulting in black tarry stool or red blood stool, as well as in women you have long periods, heavy menstrual bleeding and other vaginal bleeding. This shows that it's at risk for iron deficiency anemia. Now coming to treatment of anemia, this is a standard treatment for anemia. We have tablets, and among the tablets we have ferrous sulfate tablet, iron dextran tablet, 200 milligrams. These are the two tablets which are mainly given. It's available also in the primary and the government sector. But before using this, there are certain things which you should know. First, we should know whether the person is allergic to iron or not. Secondly, iron, if you have an iron tablet, you can have what is called the iron overload syndrome. You are giving the iron, but the person is not able to tolerate the iron. The person is having headache, black tarry stools, etc. Then hemolytic anemia, lack of red blood cells. If that is there, you should not give anemia. You should not give iron. You should ask about that. Then porphyria, again a genetic disorder that causes symptoms affecting skin. Thalassemia, liver, kidney disease. And if you are an alcoholic or if you receive regular blood, these are all the things which the person, the physician should ask the patient whether the person is suffering or has any history of this. So, hemolytic anemia is not a case of iron deficiency anemia, okay? Or for that matter, porphyria is not iron deficiency, but that may affect the treatment of giving iron. So, these things have to be asked. Again, thalassemia is another one. Liver or kidney disease. These are again things which cause a problem in the absorption of iron. So check whether the patient is allergic to any drugs or foods, or if you have all this. And most iron medications are taken on an empty stomach. Okay. So for better absorption, don't give it after food. At least 1 hour or 2 hours before meal. Okay. 1 hour before or 2 hours after meal. That is the standard requirements. Now, this is a treatment of iron deficiency anemia. Treatment is by oral or parenteral iron prepared. Oral means you are giving a tablet. Parenteral means you are giving injections. Now, oral tablets it corrects the anemia over time, just as much as parenteral iron. If the iron absorption from the gastrointestinal tract is normal, you can just give tablets. But if it is not normal, or if you want to have it fast, then you have to give in the form of intravenous things. So that is why. So it may not be possible to give it always orally. You may need to give it the parenteral route also. Okay. Then different iron salts provide different amounts of iron. So you have ferrous sulfate, ferrous fumarate, etc. And in iron deficient individual, 50 to 80 milligrams can be incorporated in hemoglobin daily, and 25% only can be absorbed. So how much you give, only 25% of can be absorbed. So you have to be very careful. Then apart from the medicines, one of the common things is the diet. Whatever diet, it's not necessary that you must have non-vegetarian food alone to boost up your anemia, to recover from your anemia. Usually, the good sources of iron include meats, which include beef, pork, lamb, liver, and other organs, poultry, chicken, duck, turkey, liver, fish, shellfish, including clams, mussels, oysters, sardines, anchovies. And this one is most important, green leafy vegetables of the cabbage family, broccoli, turnip greens, collards, legumes. So basically, green leafy vegetables are a big source of iron. It doesn't mean that a poor person has to take fish or chicken or meat every day. You can have any of these things like green leafy vegetables, spinach, peas, beans, etc. These are very common things for the iron deficient, iron-rich diet for get blood. So once again, liver, egg yolk, red meat, fish, and shellfish. The first 5 are for non-vegetarians. Next, you can as I said, you don't have to be non-vegetarian to have the food. You can take lentils, beans, soya foods, green leafy vegetable raisins. One common mistake is that milk is very rich in iron. No, milk is not rich in iron. In fact, milk is very low in iron. So, if you think that you take too much milk, your iron will increase. That's a misconception. Then iron utensils also increase iron content of food. So, when you're cooking the food in some iron pot, a part of the iron comes along with the food. So that while cooking, that increases the iron consumption. So these are the sources of iron. You have the mostly green leafy vegetables, and fish and meat are there. The milk is not there. And so this is the ferrous sulfate is a drug of choice for iron deficiency anemia. 325 milligrams given thrice daily, out of which only 180 milligram it contains 180 milligram, and only 10 milligrams is absorbed. Okay, so you are giving it so much, but only this much is absorbed. Patient who cannot tolerate it on a empty stomach should take it with food. So this is the common drug, this ferrous sulfate. Apart from that, we can also have other things. Now, what are the common adverse effects of iron deficiency anemia? The commonest one is epigastric pain, nausea, vomiting, then abdominal cramps, black stool. You are giving iron, the stool becomes black. The patient will come to you saying that paikana kala hoye gache. Okay, so these are all usually dose related, constipation and diarrhea. So these are the common things which are there in your iron deficiency anemia side effects. So whenever you give the patient the medicine, tell the patient that A hote pare, bomi hote pare, paikana, patla paikana hote pare, kala paikana hote pare, and all this. Okay, but these are all generally dose related. This anemia, the main iron deficiency anemia, the main treatment is giving iron tablets, and as we saw in the slide, last slide, ferrous sulfate is the drug of choice, and 325 milligrams thrice daily gives you only 180 grams, out of which only 10 milligrams is absorbed. Okay. Now, this iron deficiency anemia is a major problem in developing countries, particularly India, and because of various reasons. One of the reasons for iron deficiency anemia being a major problem. What could be the reason? What could be the reason for iron deficiency anemia being a major problem in India? Well, what is the reason? What could be the reason for iron deficiency anemia becoming a major problem? So we stopped here the last while we were presenting. It's given administration is per orally, so it's given orally. This iron ferrous sulfate tablet is given orally. These are side effects of giving the tablets, mainly nausea, vomiting, abdominal cramps, constipation, diarrhea, and black stool. Okay, so these are usually dose related. And there are other things that avoid taking any multivitamin or mineral product within 2 hours before or after taking your iron supplementation. Avoid antibiotics like ciprofloxacin, demoxycycline, doxycycline, levofloxacin, levofloxacin, and avoid antacids within 2 hours before or after meals when taking your iron absorption. So these are certain precautions that you should take while giving iron tablets. Okay. So if the patient is taking antacids, that affects the absorption of iron. Similarly, antibiotics also interfere with certain antibiotics interfere with absorption of iron. Then parenteral iron therapy is given iron dextran. It is a complex of ferric hydroxide and low molecular dextran. It can be given deep IM or IV injection. Again, adverse effects are there: lightheadedness, fever, arthralgia, backache, urticaria, itching, bronchospasm, and hypersensitivity reactions. So iron dextran is not suited for everybody, but if the patient needs it, if the patient cannot tolerate the tablets, you have to give iron dextran. This is given either as IM or IV, IM injection or the IV infusion. So these are the common tablets which are given: ferrous sulfate hydrated, tablet size is 325 milligrams, and elemental and iron only 65 milligrams. So you need about 3 to 4 tablets. So same thing with ferrous sulfate desiccated, which is dried, 65 milligrams. The tablet size is 200 milligrams, 3 to 4. Ferrous gluconate, again you need 3 to 4. So basically, elemental iron per tablet is just less than 50 or maybe a little more than. Ferrous fumarate is the one which has 325 milligrams and 106 milligrams per tablet. So you need only 2 to 3 tablets per 2 to 3 adult dosage. Okay. This we talked about already. Sources of iron: egg, livers, egg yolk, red meat, fish, shellfish, lentils, beans, and soya foods, green leafy vegetables, and raisins. Milk is very low in iron, and iron utensils increase the iron content of food. So, what are the adverse effects of anemia? Anemia by itself is disease. Okay, what does it cause? It causes reduced physical development. It causes impaired sexual and reproductive development, and it also causes reduced cognitive development. So, what happens? Reduced physical development. What exactly happens? Decreased work output. You cannot work as much as you want. Okay. So one of the reasons why we were not doing, or we are still not doing is good in sports is this, because reduced physical development. Most of the people who are athletes and all, they come from a lowest, they are encouraged to play, but then they are not from a very well-off society, and they are having a very poor diet. So that's why by the time they are picked up by the sports authority and all, then only it becomes difficult. By that time it's difficult to push them into the national or international level. Okay. So reduced work output, reduced work capacity, irregular menstruation. So irregular menstruation is a major cause of, major effect of anemia. So because of it's also cause as well as effect. So irregular menstruation, then low pregnancy iron stores and low birth weight babies and preterm delivery. These are also cause of anemia. So if the mother is anemic, then there is a chance of low birth weight and preterm delivery. Reduced cognitive development, diminished concentration, disturbance in perception, poor learning ability. So if you don't get good food, if you are anemic, obviously you will not be able to concentrate, you will be fatigued, you will not be able to concentrate on studies, and there will be poor learning ability, disturbance in perception. What others understand, you cannot understand because you are anemic. So these are adverse effects of anemia. So if you look at the classification of anemia, so what is the severe, mild and moderate? Children between 6 to 59, the hemoglobin is more than 11, there is no anemia. Children between 5 to 11, more than 11.5, there is no anemia. Non-pregnant women, children 12 to 14, more than 12, it's not anemic. Non-pregnant women, more than 12, not anemic. Pregnant women, more than 11, men, more than 13. Now, when we say it's mild anemia, the child is between 6 to 59 months of age and the hemoglobin is between 10 to 10.9, it's mild anemia. Between 5 to 11 years, 11 to 11.14, 11.4, that is considered as mild. 12 to 14, 11 to 11.9 is considered as mild. Non-pregnant women, 11 to 11.9. So anybody, the pregnant women, 10 to 10.9 is considered as mild. Men, 11 to 12.9. Okay. So these are the standards. So don't get panicked by this. So maybe some of you may be following this. Moderate, 7 to 9.9 is children 6 to 59 months. 8 to 10.9 is children 5 to 11 years. 12 to 14, 8 to 10.9. Non-pregnant women 8 to 10.9. Pregnant women 7 to 9.9. Men 8 to 10.9. Severe anemia is below 7 for children below 5 years, below 8 for children between 5 to 11 years, below 8 again for 12 to 14 years, below 8 for non-pregnant women, below 7 for pregnant women, and below 8 again for men. Okay. So in adults, the severe anemia is more or less, it is almost fixed at 8, with the exception being pregnant women and children between 6 to 59 months, where it is severe, where severity starts if it is below 7. Okay. Now, here again, 58% of pregnant women are anemic, and estimated it's an underlying cause for major maternal deaths in India. Okay. So, different age groups, what is the prevalence of anemia? Children between 6 to 35 months, 79% are anemic. And 6 to 59 months, 69%. And all women, 55.3. Then you have a breakup among pregnant women, lactating women, and adolescent girls. Adolescent girls are at a high risk. They have about 69.7%, followed by lactating women and pregnant women. Okay, lactating women is 63.2, pregnant women it is 58.7. So this is a major problem. India has the second highest population in the world, and 50%, more than 50% are females, and as a result of that, we have this high prevalence of anemia. Okay. So, what are the programs for controlling anemia? You have a national iron initiative. It follows a life cycle approach for iron deficiency anemia. So, it includes 6 to months to 5 years, 6 to 10 years, adolescent, women of reproductive age, and pregnant women. These 6 categories come under this national iron initiative. So, here what we have what is called weekly iron and folic acid supplementation, or WIFs. That is for adolescent boys and girls. It's also called WIFs. Okay. So this is again the prevalence of anemia among adolescent girls 12 to 19 years and young women 20 to 29 and various. So if you look at the 12 to 14, again any anemia is less than 12. But if you look at again 20 to 29 also, that's age group. You have 56.1 have some form of anemia. But severe anemia is much less. Severe anemia 1.7, over there it is 1.1. And moderate anemia is almost same figure actually. Moderate anemia is more is higher in the 15 to 17 years group, and in fact it in 20 to 29 years, it is more than what is there in the 12 to 14 years. So one of the reasons is that our eating habits, somebody tries to have some dietary fads, I will not take this, I will not take that, and all these things can cause this. So you can see the picture, 12 to 14 years, the mild anemia is 27%, but 20 to 29 years, on the extreme right, the mild anemia is 38%. So as you, 20 to 29 years, the young women, they have a higher rate of mild anemia. Okay. So then what is WIFS? Weekly iron folic acid supplementation. This was started in the year 2000 and they targeted as a UNICEF project, and they targeted school going and out of school adolescent girls in 20 districts. So what they used was government schools, Anganwadis, and what are the channels which were used were nodal teachers, Anganwadi workers and peer educators, and they were given weekly iron and folic acid tablets, biannual deworming, that is, you are giving medicines for removing the worms, and nutrition, health education. So these were the things for weekly iron and folic acid supplementation. This started very recently in the year 2000. So the aim of this was to reduce the prevalence of anemia, and severity of nutrition anemia in adolescent population, 10 to 90 years. Target groups were school-going girls and boys, and adolescent girls who were also not in school. So it's not just the people going to school. Somebody is working in a shop or something, not going to school. Somebody is dropped out of school. They're also being targeted. This was the objective of weekly iron folic supplement. So they were given 100 milligrams of elemental iron plus 500 micrograms of folic acid throughout the year. Deworming every 6 months with albendazole, and screening and referral services, and nutrition and health education counseling. So these are the main way in which this weekly iron and folic acid supplement WIFS was implemented in India. Okay. So what are the anemia causes in India? One is faulty infant and young feeding practices. Now, what do you mean by faulty infant and young feeding practices? The first is the mothers are not taught about lactation, how to give proper breast milk, and in case the breast milk is not coming out, the mother stops feeding, the child is not getting breast milk, number one. Number two is the child is not getting breast milk, the child, they get some artificial food which is less nutritive than the breast milk. Then dietary insufficiency in iron, the mother is not taking proper good nutrition, she is not taking green leafy vegetables or meat products or anything so. Presence of iron absorption inhibitors, then parasitic infection like malaria and hookworm infestation. So hookworm is another thing which can cause, it's no longer there much, but it was there in the past. Malaria also can cause anemia can cause poor iron stores during infancy and childhood, and hemoglobinopathies like sickle cell and thalassemia. This is for anemia in general. Okay, this part is only for anemia in general, not for iron deficiency alone. Now, this is a data program which is introduced, Anemia Mukt Bharat, started in 2018, also known as INI Plus Initiative, that is Intensified National Iron Plus Initiative. So this complies with targets of Poshan Abhiyan and National Nutrition Strategy set up by NITI Aayog. Main objective is to reduce the prevalence of anemia by 3% among children and adolescents and women in the reproductive age group 15 to 40 years. Okay. So this children, adolescent and women in the reproductive age group are targeted. The previous one was only adolescent children, but here we are having also children, adolescents and women in the reproductive age group 15 to 49 years. So it's a big group. So this is also part of the sustainable development goal. Goal number 1 says no poverty. So anemia is supposed to contribute about 17% low productivity. That is, if a person is anemic, that person cannot work. Okay, so the productivity of the nation drops because the person is anemic. You can't make 10 people who are anemic lift up a lot of things and make a building. So that is at low product. Second one is zero hunger. Again, anemia is also part of all forms of malnutrition, which is committed to be ending by 2030 and addressing by 2025 the nutritional needs of adolescent girls, pregnant women, and lactating. This is why it is implemented at national level, because of this sustainable development goals that you will be learning further in your next few classes. Then sustainable goal number 3, good health and well-being. So here iron reduces maternal anemia. 20% maternal deaths are due to anemia. So iron prevents maternal deaths during prenatal period. Then again child mortality. Iron prevents intrauterine growth retardation, low birth weight, prematurity. Iron enhances the immunity of the person and reduces frequency of infections and decreases childhood mortality and morbidity. And the target 3 is that malaria causes hemolysis and anemia. That also is reduced by giving iron. Then quality education. So that is also important. So unless the person goes to school, how will they get educated? So for that, again, it enhances the immunity, reduces frequency, severity of infections, and decreases childhood mortality. Thereby, it improves school attendance, retention, learning capacity, and school achievement. And goal number 5, gender equality. Anemia is more severe in girls than in boys. Iron improves women's health, increases work performance, and productivity. So, anemia book Bharat is a 6 by 6 by 6 target. So, you have six strategies, 6 interventions, 6 institutional mechanisms, 6 beneficiaries. So, this is 6 by 6 by 6. Okay. So, approximately 450 million beneficiaries, that is 50% of the country's population will be reached by this. So, what are 6 beneficiaries? The first beneficiary is children, 124 million children between 6 to 59 months, 134 million children between 5 to 9 years, then 150 million adolescent boys and girls, then 30 million pregnant women, 27 million lactating mothers, 17 million women of reproductive age. So, this 6 people, 6 other groups are the beneficiaries, 6 beneficiaries. So, a total of approximately 450 million beneficiaries, roughly half of India's population. Okay. So, this is the 6 beneficiaries, that is starting from children, all children, then you have adolescent boys and girls, pregnant women, lactating women, and at the end of it, women of reproductive age. Then the 6 interventions. What are 6 interventions? First is iron folic acid. Then second is periodic deworming of children, adolescents and pregnant women by giving albendazole. Number 3 is behavior change communication. The campaign is solid body, smart mind. And along with that, during delivery, delayed cord clamping, that which allows maternal nutrients to go through the placental cord. Okay. Then also testing of anemia using digital methods and point of care treatment. So testing of anemia is very important. You can nowadays you can test with like your glucometer, you have things which can test it. Then mandatory provision of iron and folic acid fortified foods in public health programs. So in places where there is, in spite of all this iron, folic acid and all this, you can't do anything. You give fortified iron. Fortified iron means you give iron along with something to strengthen. What you have to give to the common thing. Like for example, if you give iron with rice in a rice eating area, people will take it so long there is no change in the taste. But so that is fortification. You are giving something extra without changing taste, which is acceptable to the people. So that is point number 5. Mandatory provision of iron, folic acid, fortified foods into public health programs and addressing. And sixth one is addressing non-nutritional causes of anemia in endemic pockets with special focus on malaria, hemoglobinopathies and fluorosis. These are 6 interventions. Then 6 institutional mechanisms, intra-ministerial coordination. Second one is National Anemia Book Bharat Unit. Third one is National Center for Excellence and Advanced Research on Anemia Control. Convergence with other ministries. Now, for example, this is not just a health related program. You need to coordinate with, say, for example, the food ministry also, because they are the people who supply food. Okay. Then, so that is why it's important. You need to coordinate with the Ministry of Education also, because they are the ones running the schools. You need to interact with the Anganwadi teachers and other teachers. Then strengthening supply chain and logistics. So, for any such program, there should be constant supply of things. You can't say that the iron folic acid stopped supply 1 month back. So, what will happen to your program? So, then Anemia Book Bharat dashboard and digital portal, one-stop shop for anemia. Okay. So, you have a website, you have a dashboard, you can find out what's happening there. So why this was successful was because it started. This is again similar programs worldwide. You have this GAIN, Global Alliance for Improved Nutrition, and they again had the food fortification, access to healthy and safe foods, and improved dietary practice. So this program had fortified staple foods like flour, oil, sugar, with essential vitamins and minerals, improving nutritional outcomes for millions of people. So if you tell somebody to go and have something, that person will not have. But if you give it in something else and it is supplied to the Asian shop, that person will take it. That is called fortified food. So again, in India we had programs before also. National Nutrition Anemia Control Program is called NNACP. Weekly Iron Folic is much recent, and National Iron Plus Initiative. So an intensified NIPI program is referred to as the anemia book strategy. Okay. So what are the most successful interventions? Nutrition education and promotion, access to iron supplementation, improved sanitation, food fortification, mass drug administration. The first one is you are educating the people regarding the balanced diet, which contains iron and other vitamins. Second one is just educating the persons cannot do it. You have to give the, where is it available? You tell a person, Santal neighbor, to give mangso khao. Where's the money for mangso? But he's got green leafy vegetable in his own bagan. You can have that, which will probably have the same nutrition as the same amount of iron as he has in chicken or whatever. Okay. Third one is improved sanitation hygiene. Poor sanitation and hygiene practice can lead to increased prevalence of anemia, and improving these practices can reduce anemia prevalence. Like we have had we have had various programs which can sanitation program. Then fortifying foods with iron can help iron intake for individuals and help reduce anemia prevalence. And mass drug administration again, give anemia iron supplements on one particular day. That has also been proved to be effective. Okay. So what is the success rate? In these states they have been very successful. Gujarat, Karnataka, Madhya Pradesh, Maharashtra, Orissa, Rajasthan, Telangana, and here and West Bengal also. And 4.2 crores children have been tested and diagnosed for anemia. 2.45 crores adolescent girls have been tested and diagnosed. 3.2 pregnant women, crore pregnant have been tested and diagnosed for anemia. So these are the achievements of the anemia book bar. Again, lactating women have been tested, 1.6 crores. 3.2 lakh awareness caps on anemia, and in rural and urban areas organized, and 5.6 lakh workers have been trained on anemia management and diagnosis. Okay. However, there is still some gaps. There is certain gaps in the dissemination and implementation of AMB at the district level, and in some states there has been nothing, which do not have, many states do not have not completed the printing of literature enough, and many states have not given allocation. 50%, only 50% states have had allocation till 2019. Okay. So interventions work best for Madhya Pradesh. It is, they have done very well. And the problem is low accuracy in anemia screening, low iron and folic acid due to side effects. So whenever you tell somebody to take an iron folic acid tablet, after taking 2-3 doses of it, so that's one side effect. Then iron and folic acid, suboptimal iron folic acid procurement and distribution process. Sometimes the supplies of iron folic acid do not come in time or they are delayed. Lack of concurrent monitoring, that is how good it is, nobody is monitoring what is happening. Everybody thinks on paper. Limited knowledge on importance of iron and folic acid. Many people are unaware of iron and folic acid. However, overall, Madhya Pradesh ranked first in this thing 2020, but still we need to look beyond iron deficiency anemia, and they are also looking at sickle cell anemia and other things. Okay. So these are the interventions which work best for this. The first one was anemia testing. The second one was IFA reformulation, that is from ferrous sulfate they went to ferrous ascorbate, which is slightly easier to absorb. The third one is iron folic acid supply chain strengthening. They defined standard inventory and procurement norms, developed and supplied the implementation of iron folic acid last mile delivery. That is how to reach it to the last possible beneficiary, the person who is in the remote area. How does it reach there? That they have solved out in Point number 3, supply chain strengthening. This next is robust monitoring and increased iron folic acid uptake. They developed scientifically backed collaterals and supported a national mass media campaign under Anemia Mukht Bharat. So these are the ways which work best from Madhya Pradesh. We don't have data on West Bengal at the moment, but this is a place where 2017 to 2021, they were ranked 6, they became ranked 1 in iron folic acid coverage. Okay, so this is all. Let's make India anemia free. This is a slogan from the Ministry of Health. So I'm just going through the slides once again. This for people who said that I'm a bit too fast. Oh, sorry. I'll go to the last slide. This is the last slide. So the questions which are normally asked us in the university is: control of iron deficiency anemia at the community level. What is WIFS? What is Anemia Mukht Bharat? These are 3 common questions which come in the for your community medicine exams. But since you have one of your friends said I'm going too fast, I'll just spend a few seconds on this earlier slides, which I think we may have hands. We are also disrupted. So, iron deficiency anemia, you know what is anemia? It's caused blood has a lower than normal RBC, and iron is essential for hemoglobin. Iron deficiency is a condition in which anemia body lacks enough iron, enough RBC to transport oxygen blood to body tissues. So this you know about this anemia cycle, the RBC cycle, how it is started. It's the most common form of anemia, and if it develops over time, the body does not have enough time to manufacture it, and then the body takes the iron resources from the stored iron in the liver, bone marrow, and other organs. This is a picture of iron deficiency anemia. In the slides, you've seen it. Usually due to blood loss, poor diet, or inability to absorb enough iron in the blood. The blood loss causes depletion, and it's common in women who have long or heavy menstrual periods or bleeding fibroids, childbirth, internal bleeding, and poor diet, low iron intake, and some cases stages of life where pregnancy and childhood. Then even if you have enough iron, it may not be absorbing it because maybe the intestine is not enough, or it's after intestinal surgery, or some other disease. There are also medicines that interfere with the absorption of iron. So this is a clinical presentation: brittle nails, cracks in the side of the mouth. And you also have extreme fatigue. Patient is feeling. Quite often you find the people say, "खूप क्लांत हो गया, खूप क्लांत हो गया." Just a good idea to check for anemia. खूप क्लांत हो गया. Of course, it's possible. It's very hot and all, but then there's a chance that it could be anemic also. Chest pain. Not necessarily all chest pain will be a heart attack. Pale skin, dizziness or lightheadedness. Mata ghutche. Okay. Fast heart rate, tachycardia, headache. Mata ghutche. These are all possible symptoms of anemia. Then you have enlarged spleen, cold hands and feet, frequent infections, irritability, shortness of breath, swelling or soreness of the tongue. These are all factors which are there in anemia. And this is specific for anemia: unusual craving for some sort of thing which is not normal food, ice, dirt, paint or starch. This is called Pica. Okay. And some people also have restless leg syndrome. They keep moving the legs often. And sign of intestinal bleeding is the blood is there may be blood in the stool. It may be bright red or dark red. Dark red is usually melena. Bright red is usually some intestinal bleeding. Heavy menstrual bleeding, long periods, long gap between long periods as well as long gap between can suggest that woman is at risk for iron deficiency anemia. These are tablets which are usually given. Iron dextran tablet is also there. Ferrous sulfate is also there. Ferrous fumarate is also there. And before giving this, you have to check whether this patient is allergic to any drugs, or if he has iron overload syndrome, hemolytic anemia, porphyria, thalassemia, liver or kidney disease, or an alcoholic, or if you receive regular blood donations. And most iron are on an empty stomach at least 1 hour before or 2 hours after meals. Treatment is usually by oral iron. If not, parenteral iron in the form given with dextran. So in iron deficient individuals, 50 to 80 milligrams of iron can be incorporated in hemoglobin daily, and only 25% is absorbed. So then you have the diet, non-pharmacological interventions, like meat is a good source of iron. Beef, pork, lamb, liver, other organic meats, poultry, chicken, duck, turkey, fish, shellfish, including clams, mussels, sardines, anchovies, green leafy vegetables, including broccoli, cabbage, turnips, greens, legumes, etc. So again, once again, liver, egg yolk, red meat, fish, and shellfish. This is what we see normally among non-vegetarians. Vegetarians, lentils, beans, soya foods, green leafy vegetables, and raisins. Milk is low in iron. Iron nutrients also increase iron content of food. So this is a drug of choice, ferrous sulfate. So you're giving 325 milligrams, out of which only 10 milligrams is actually absorbed. 10 milligrams of elemental iron is only absorbed. Okay. The side effects are nausea, epigastric pain, abdominal cramps, constipation, black stool, and these are usually dose related. And avoid taking any other multivitamin, also avoid taking the following antibiotics, and avoid taking antacids within 2 hours before or after meals when taking iron medication. Parenteral iron therapy is ferric hydroxide and low molecular dextran, can be given deep IM or IV. Adverse effects are lightheadedness, fever, arthralgia, back pain, urticaria, bronchospasm, hypersensitive reactions. These are the common things. So, iron ferrous fumarate, you give 325 milligrams, you get 106 milligrams. So, you get only 1/3 iron of 1/3 to 1/4 of the iron. This we talked about. These are adverse effects of anemia: decreased work output, decreased work capacity, irregular menstruation, low birth weight babies, diminished concentration, disturbance in perception, poor learning ability. These are classification of anemia in various age groups. If it is below 7, it's considered very severe in children and pregnant women. Below 8, it's in other groups. Other classification mild and moderate. And we have a good it's a major problem in India because we have nearly 50%, more than 50% of women are anemic. Okay. So then we started this program, National Iron Initiative, which includes weekly iron folic acid supplementation. So it was started in 2000, started in schools, Anganwadi schools, and was done by teachers and non-teachers. Weekly iron folic acid, biannual deworming, nutrition and health education. And this was done for the adolescent population, 10 to 19 years, school-going girls and boys and adolescent girls who are not in school. Weekly iron folic acid, deworming by albendazole every 6 months, screening and referral service, nutrition, health, education, counseling. Then came, these are the causes of anemia in India: faulty field, infant child feed practices, dietary insufficiency, presence of iron and absorption inhibitors, parasitic infections like malaria and hookworm, poor iron stores and hemoglobinopathies. Then Anemia Book Bharat. This started in 2018. The aim was to reduce prevalence of anemia by 3%, and adolescents, children, and women in the reproductive age group 15 to 45. So this is why it was implemented, because of sustainable development goals mentioned: no poverty, zero hunger, good health and well-being, etc. Quality education, gender equality. So we have a 6x6 strategy to combat anemia. So what is it? 6 beneficiaries. You have all these are 6 beneficiaries: the children, school children, adolescent boys and girls, pregnant women, lactating women, and women of reproductive age group. All this comes. Interventions: iron folic acid, periodic deworming, behavior change communication, then testing of anemia, provision of iron folic acid again, and addressing non-nutritional cause of anemia, particularly focusing on malaria, hemoglobinopathy, and fluorosis. Institutional mechanism: these are all the other various governmental mechanisms for this, and this was implemented in other places also, which is why we started this. And so this is the successful interventions which have been there: nutrition education, access to iron supplementation, improved sanitation, food fortification, mass drug administration. And one of the success stories has been Madhya Pradesh. Apart from that, Gujarat and all this also they've done a good job. Madhya Pradesh is one of the great success stories. And the last thing is, let's make India anemia free, anemia Mukt Bharat. And these are the questions which normally come in the exam. Okay, thank you very much.